My name is Tina, and I was diagnosed in 2002. I was 30 years old. Prior to being diagnosed, for 2 years, I had multiple symptoms. Anything from, like she said, bloating, fatigued, nauseousness, everything. I went to several doctors, and I was diagnosed with anything between IBS, diverticulitis. At one point, I was told that it was all mental and that I was crazy. I was put on several medications, and everything kept on coming back. I did endoscopes, colonoscopies, every 3 months, and it continued. Well, life goes on, and you have to work, you have to, do your daily activity. And I was at work and wasn't feeling well, came home, and went to sleep, woke up the next morning, and I was bleeding, which I thought was just my regular monthly period. I turned pale and called the doctor. He told me to come in right away. Came in, and my blood pressure was down. It's kind of really hard to talk about. My temperature was down, and he told me to go to Passaic Hospital and do a vaginal ultrasound. Well, let me tell you, when you do a vaginal ultrasound, when you have, what I found out, 2 tumors on your ovaries, it's not a pleasant feeling. You have this probe going up on you, okay? You cry, you yell, you scream. And I have to tell you that the people that were there, it was kind of just like a regular routine kind of thing. Unfortunately, I did not have the experience when I dealt with doctors and nurses of a warm, fuzzy feeling. I didn't. At that time, the doctor said, oh, you have a mass, one size of a watermelon kind of melon thing, and the other one on the other ovary of a orange. You have to have emergency surgery. And I'm like, okay. I had no idea what was going on. 3 days later, I was in surgery. I asked the doctor to try to preserve as much as you can because I was young. I was starting a new family with my husband-to-be, and I wanted to try to have another child. So we had the surgery. He comes out and he says, oh, everything looks okay. We removed your tumors and we left you with 1 ovary. You should be able to conceive a child, no problem. I'm like, yay! I get to go home and lead my life and everything's good. Came home, healed up, went back to the doctor, took the stitches out. He says, oh, you have to go to my partner. I'm like, why do I gotta go to your partner? He'll tell you why you have to go there and what's going on. So I go to this other doctor with my fiance at the time, and had no clue what was going on. I'm walking into the doctor's office and I'm reading, it's a oncologist. And I'm like, why am I here? What's going on? We get inside. I'm trying to cut everything really short. We get inside and the doctor says to me, you have stage 3C ovarian cancer. I was like, what? What? But he just told me everything was fine. It was the most devastating news ever. And he made it like it was nothing. It was no big deal. Oh, we'll go in, open you up again, and you'll have a hysterectomy, give you some chemo, no problem. I guess I was naive at the time because I didn't know what questions to ask. I trusted doctors. I felt like, you know what? You are the people who went to school, who studied, and know what to do. I came home, and of course we cried, and had to deal with all that emotions. I had to tell my daughter what was going on. It was very, very hard. Then we decided to see other doctors. All the experiences with other doctors were the same way. I had one doctor who pretty much didn't even look at me. And he looked at my husband, well, my fiance, sorry, and he kind of said, well, sir, it's like opening up a hood of a car. Once you get in there, we kind of move everything away and we see what's going on. And I'm like, are you serious? I'm a car? Like, get real. It's ridiculous. So, needless to say, my husband grabbed me and he's like, we're out of here. This is such a quack. Let's get out of here. So we found another doctor. We went in and she suggested that we go in again and remove the augmentum and lymph nodes and see what the progress is, what everything is. So I had another surgery about 4 weeks later. They went in, removed everything. That surgery was not very well. I bled out. I died on the table. I came back, came into the room. I had blood transfusions. I had 3 bags of blood transfusions at that time. She said it was stage 3. It had spread to my gallbladder, to my lymph nodes, to everything else. She said we can't do anything else. We have to go back in and do a radical hysterectomy. So waited another 3 weeks and did another surgery to remove everything. So it was surgery after surgeries. Then of course, chemo. I did Toxel and cisplatin. Now again, this was 12 years ago. There was no advance in medicine, I had the port put in, which is an ordeal in itself because when you put this port in, I don't know about you, but I was wide awake. Were you awake when they put it in?
I don't remember.
Yeah, they don't tell you that, oh, we're going to put this port thing in, but you're going to be wide awake.
I think I was under.
No, I was wide awake, and they just numb the area, and you're in this cold OR room, and you're like blocked off, and you get to hear everything that's going on and feel all of that. That's what I felt. It was horrible. Anyway, so you go in for your chemo, and they start pumping you, and within maybe 5 seconds, I blew up like a balloon. My husband says I looked like the Pillsbury Doughboy boy. Like I was blowing up, and my heart stopped. I went flatlined. Again, doctors came in, crash cart came in, and they revived me. It turned out that I was that 1% of patients that was allergic to the Toxel. So the doctor says, well, I have to kind of look through my books because I've never experienced anything like this. So I have to see what the protocol is. We waited, maybe 2 weeks or something. So we did another round of cisplatin and Toxel within like a 6-hour limit because we were doing it slowly. Well, that night, I became blind. I couldn't see. Ended up in the emergency room. And They did not even want to admit that it was the chemo that was doing it. Within maybe 48 hours, my vision came about and came back home. You know, throwing up, fatigued, everything. The doctor was just like, you know, you have to go through it. You have to do this. You have to, you know, deal with it, and that's that. Went back into to do the second set of chemo, and did the same thing as the first set. The second one, I became paralyzed from the waist down. Ended up in the hospital again. I was at my wit's end because I felt that all the surgeries that I had, the chemo was the worst for me. I felt that the chemo was actually killing me versus the cancer itself. My third session came about the same way. I sat down with my husband and my daughter and I said, you know, I'm not doing it anymore. I took the decision to stop chemo. The doctor said basically that I was going to die within the next 3 to 6 months. It was my choice, and she just sent me away, and that was it. And 6 months came, I went to do my CAT scans and my blood work, and everything was fine. There was nothing going on. I was like, okay, good, you know? Another 6 months, everything was fine, no problem, everything good, you know? What bothered me about this whole thing is that all those years, those 2 years that I went through, going through every doctor, and it was like no one wanted to listen, no one wanted to take the time to explain things. So every time I see a woman and I talk to young girls and I tell them, you know, you really have to listen to your bodies. Whatever you feel, and when you go to a doctor, you have to tell them exactly how you feel. And you know what? If that doctor doesn't listen, then you have to go to someplace else. Or you have to tell the doctor, hey, listen to me, I'm talking to you. And that's one thing that I'm like right now, when I go to a doctor and I see that he's very busy and he doesn't have the time to actually listen to what I'm saying, I'm very upfront and I'll say, excuse me, just give me, you know, 10 minutes of your time and hear what I have to say. And then you can go on to somebody else. Because I know you're busy. I know all doctors are busy. But you took an oath to help people. And that's part of it, is being helpful, being compassionate to a person. And unfortunately, I didn't feel that when I went to my doctors. I think that's it for now. How's that?
And I'm an ovarian cancer survivor, stage 3C, advanced ovarian cancer. How I was diagnosed, so many years ago, like a lot of years ago, I noticed a pattern in my family where a lot of the women on my mother's side of the family, it was a large family, 6 siblings, the women either had ovarian or breast cancer. And nobody really bothered to think that maybe there was some genetic link in the family because genetics wasn't a big thing 8 years ago or so. What I decided to do was take the BRCA test before it was really fashionable. And I found that I was BRCA 1 and 2 negative. And they did a BRCA multi-site. I was BRCA multi-site negative. And I'm saying, all right, and they're saying, well, this stuff must have been environmental, which is a buzzword, but we have no idea where it falls. So as the years went on, basically what I was told to do was have a transvaginal ultrasound once a year and have a CA-125 test. Do you know what that is? Don't know what that is? So basically it's a blood test that is able to look at proteins that can tell whether you are, if they're elevated, you might be prone to be getting ovarian cancer. And my my tests were always low, very even, and one day I went to my gyno and he took the test, and it went from 6, so let me give you a baseline. It goes from 0 to 34. 0 being great, 34 being watch out. You're heading toward bad stuff. And mine went from 6 to 44. And I have to tell you that that number doesn't mean much in the total scheme of how bad a cancer can be, because people's can go up to like 3,000s. But I went back for a transvaginal ultrasound, and just so you know, I had 0 symptoms, 0. The only thing, I'm always bloated after I eat, and they say bloated, constipation, frequent urination. Well, I have all those as a normal course of life, so nothing changed. And I'm in sales, and the only thing I noticed was that I started to feel really tired, like almost falling asleep in the middle of client lunch, which is not normally me. But you know, you just put that aside as you're a little stressed, you're overworked. So the point I'm trying to make is 0 symptoms. I went from 0 and having nothing to having stage 3C ovarian cancer. And I found myself in 1 week having a hysterectomy, correctomy, having my omentum removed, having a slice of my abdomen, a slice of my rectum removed, and being in the hospital. And the next thing I know, a month later after that healed, I'm going on an experimental treatment where I was having cisplatin, Taxol, and Avastin. Did anybody ever hear of Avastin? Show of hands, anybody? No? Okay, so Avastin was a new clinical trial that came out many years ago and got approved through the FDA. Is this stuff helpful?
Yeah.
Okay. I just wanted to make sure I wasn't going off on a tangent with you guys.
Can you just tell them how long ago this was?
Yeah, so I'm sorry. August 2011 was when I got diagnosed. Okay, and if you have a hysterectomy, it takes about a month to 6 weeks until your insides heal that you can go and have any kind of chemotherapy. So Avastin was a clinical trial that was being looked at for ovarian cancer, and basically the opportunity was there that it would go after cancer cells and restrict the blood supply so that it would shrink the cells and they would stop growing, kind of thing. And I had, just to talk about and to answer your question about what went right and what went wrong for being a doctor. The key was my gynecologist knew about this for 8 years and he wasn't on top of it. And I felt very upset and very betrayed by this doctor who let me get to a stage of where I was at late stage cancer and didn't even think about it. And the surgical oncologist that I had was so kind and so there every step of the way. 8:30 at night she came to visit me in the hospital after the surgery. And I think that's very important when you're dealing with patients that are going through one of the most scary things in their life. They're really looking for somebody to, even though you can't put yourself in a patient's situation, you need to be kind and you need to be with them emotionally and medically. And this woman just monitored everything so closely. And I guess the good news of this, with probably having one of the most horrible chemo treatments, I had a port here, I had a port in my side, and the treatment was terrible. I lost like 30, 40 pounds. It was textbook, anything bad that can happen happened to me. I wound up in the hospital several times. And so a year and a half went by of treatment, and the good news was after scans, there was no evidence of disease, which is what you want to see. A month later, the joke happened. I was on high surveillance because ovarian and breast cancer are very interrelated. A month later, it was discovered I had stage 1 breast cancer. And I had to go and have a lumpectomy and radiology, radiation. That went on for a month and a half. And it's very exhausting to the body and emotionally, mentally. You just feel very broken. And I was working through this whole thing. I don't know how I was doing it, but I was. And that was a year ago, June. And then I found out that I had a recurrence last March and had to go into the hospital last April and had it sucked up into my lung lining a little bit, but there's no such thing as, it's like being a little pregnant, you either are or you're not. It's like you have ovarian, it sucks up into a different place, you got it. So they had to go into my lung lining, withdraw the fluid, confirm that it was an ovarian recurrence, and they did a medical procedure called a pleurodesis. Anybody ever hear of that? Yeah, it's pretty terrible. I think it was worse than the hysterectomy. They basically go into your lung lining, they extract the fluid, and they replace it with a chemical talc that's very irritating and very painful. I still sometimes feel pain, residual pain from that, but went through another round, 6 months of chemo, and I'm here to tell the story, but there's one thing that has recently come out, which I don't know if you're aware of. The FDA fast-tracked a new medication called Lynparza. Did anybody ever hear that? Probably not, because most of my doctors haven't heard about this. But Lynparza is meant, we were just talking about the whole genetic thing for a minute. So it's for people that, oh, let me just back it up. A new test came out about a year and a half ago called the OvaNext test by Amber Genetics. And genetics has become very, very interesting because we're able to find out a whole lot more than we ever were able to know. And I have 3 biological daughters, and all of this is very important, not just to me, but to my kids. So I took this test that looks at 23 new genetic mutations that a person can have. And it came back that said I had the BRIP1 gene mutation, which nobody's ever heard of. Yet it contributes to 3 times more the probability of getting ovarian or breast cancer. And that's probably what's running through my family that nobody wants to deal with. And the interesting part is that if you have children, 50% of your offspring might have this too. And my oldest daughter wound up having this genetic mutation too, which means she has to be under high surveillance. But the good news is at least she knows. That's better than me walking into this blind thinking something's going on, nobody's bothering to uncover it, so you just kind of let this stuff happen. So just linking that to Lynparza, this is a whole new way of looking at cancer maintenance treatment for people that have had late-stage recurring cancer, ovarian. And it's meant to target the gene mutation. And it's really targeted for BRCA, but because I have a BRIP1 that's directly related to one of the BRCA, whatever it is, they let me in on this. And it's not a clinical trial anymore, it's right out there. And it's meant to, before the genes kind of work with the DNA, double helix, you know biology much better than I do. But before it starts to repair itself and the genes start to multiply, it stops it right when it's a thought in the gene's mind. As opposed to chemo, which you've got the disease, now we're going to try to pour caustic stuff on it and try to get rid of it. So it gets to really the root problem of it. 8 capsules twice a day, but it's a small price to pay for hoping, it's not a cure, but there's a hope that it will at least take the recurrences and spread them out long enough so that when you go on to other types of chemo, your body doesn't react poorly to it. So that's kind of where I am right now. And from a medical team perspective, that's the most important thing to somebody that's going through this horrible disease. If you know that you've got a medical team that is working in concert with each other, that's the most important thing. And as a patient, you have to really advocate for yourself. So you've got to kind of pull everybody into a medical team and make sure they're all talking with each other. And that includes cardiologists have to be part of this team, and your primary care has to be part of the team. GI people have to be part of the team. And so you need to think of this really as you're not the only fish in the sea that's working on this patient. You've got to pull in everybody that you can. So before I start going on tangents, let me pass it on to my other colleague survivors, and when we come back, I'll answer questions.
I guess I'm next. Your turn.
Okay.
Yes.
I
go last, but I'm Debbie. Nice to meet you.
Oh, nice. Are you sure you want to go last?
Yes.
Okay. All right. First, I'd like to apologize for being late. There was part of Route 1 shut down, which probably happens every day up here. I'm a little bit more south near Princeton. Okay, I think you guys kind of must have went all from your hearts, but I think I'm not quite as good of a speaker, so I kind of have it all written down, so just bear with me as I go through this. By the way, my name is Krista Shuckers. My story began in June of 2009 when I was about to find out that the word jeans means something more than just what you wear on the weekends. I am a Penn State University graduate with a business degree in MSIS. Although I know coming in here it's a little hostile environment these days. A little rivalry going on. So as I mentioned, I currently live in Princeton, New Jersey with my boyfriend, and I work as a financial analyst. The path that I dreamed of when I was your age didn't turn out exactly as I had planned. I probably seem normal to strangers walking down the street, but my journey is anything typical of a young woman. The symptoms that would lead me to a startling discovery started right before my 29th birthday. I had long, heavy periods for months that were blamed on generic birth control that I had just switched to, or just, the hormones going up and down. My voice was finally heard that fall when my gynecologist at Jefferson University Hospital found a polyp in my uterus. My mother had endometrial uterine cancer when she was 37, so I figured my doctor would be on top of it. He still had me wait a few months, but by that December, the polyp and my conditions grew worse, with 3 weeks at a time of painful bleeding. My surgery was scheduled for February of 2010 with no concerns that I had anything to worry about. I was house shopping with my boyfriend and looking towards my future. I was young, full of life, and nothing could happen to me, right? I found out how wrong that statement was 2 weeks after my surgery. The words of my doctor will forever be burned in my brain as I sat at my desk on what I thought was a typical work day. Little did I know that my life was about to change. My mind went numb as the words of my doctor came out. I'm shocked, but the results came back that the polyp is covering your entire uterus and it's cancer. So after coworkers helped calm me down from the shock, I had to tell my family the worst news of my life, that I too had endometrial uterine cancer. Despite my shock, fear, and anxiety, I immediately sprang into action and became my best advocate, which I think I heard you ladies say the same. I created a binder, did research, and tried to understand how this could be happening to a 29-year-old with so much to look forward to in life. In the next several months, everything went fast. My doctor ordered me a CA-125 test, and it came back negative. I then had a biopsy to take additional samples to see how far it had spread in my uterus. I was placed on high doses of progesterone, being that I was childless and wanted to consider preservation. A CAT scan ended up showing the uterine cancer had not gone through the wall and was therefore contained and stage 1. Against advice from his superior, my doctor actually felt that I should have a second biopsy a few weeks later. They determined it was still stage 1, but was more advanced than originally thought. Feeling a little unconfident in the answers I was receiving, I contacted the doctor that my mom's gynecologist recommended, in the gynecological oncology group at the University of Pennsylvania Hospital. That's where I have been receiving all of my care. I decided to get the second opinion, and I actually literally, it kind of seems funny now looking back, I took my biopsy samples in a brown paper bag across Philadelphia from Jefferson to UPenn. So I don't know if that's typical, but anything it took. He ended up raising my dosage of progesterone. He sent me to a UPenn fertility doctor with the continued hope of preservation. By that June, they performed their own biopsy and determined it was getting worse. They felt it would be safer for me to have the surgery as soon as possible, therefore I would not be able to preserve. I had already at that point gained about 25 pounds from the medication, and obviously was devastated that I wouldn't be able to have children as a side effect of this tragedy. I was being forced to abandon those dreams based on my survival being now obviously the top priority. As my events were unfolding, my mother discovered she had a rare genetic disease called Muir-Torre syndrome. It's a form of Lynch syndrome. It knowingly affects 1% of the population. This was discovered by accident when she questioned some terminology on her biopsy report. This led her to Muir-Torre syndrome, MLH1 and MSH2. They educated her on what this meant to her health and told her that she had a 50% chance that she passed this on to her two children. Once they already knew of my uterine cancer, they quickly had me tested as well. So this kind of was all going on at the same time. So it was definitely a lot to take on and to handle. It did come back soon after that I too possessed the MSH2 gene that explained my recent cancer diagnosis. I met with that doctor and began educating myself further, and actually most of my doctors, because most of them have not heard of Lynch syndrome or Muir-Torre syndrome. I began a preventative care regimen right away that I'll have to follow the rest of my life. My genetic mutation was explained to me as hiccups or misspelled words in my genetic repair cells, creating a high risk of actually many cancers. This includes an 80% chance of developing colon cancer, 60% uterine, and a greater risk of others such as stomach, bladder, urinary, prostate, obviously not for me, liver, ovarian, and various skin cancers. This also explains why the gastroenterology department needed a specialist in this area with the highest cancer risk coming from this genetic mutation. My full hysterectomy was scheduled 2 weeks before my 30th birthday. This included my fallopian tubes, ovaries, and uterus. It was clear I wasn't going to get to celebrate my 30th birthday quite as I had thought or look forward to. My gynecological oncologist asked if I wanted to leave one ovary, as I heard you had left one, as a sliver of hope to still have children. However, I knew after educating myself on the genetic disease that I would need everything out by my mid-30s to reduce my risk of further reproductive cancers. And being I had a 30% chance of contracting ovarian cancer, I made the best and toughest decision of my life to have the oophorectomy and remove both ovaries as well. The moments before heading to the operating room will stay with me forever as tears roll down my face. I said goodbye to my parents and my supportive boyfriend of now over 8 years. He's with me today. I realized my life as I knew it was over, and I was scared to see where it was going to lead. After my surgery, I had many complications. I also found out 2 weeks later that I also had stage 1 ovarian cancer in my left ovary. This was a complete shock to me as the doctors had not told me about this discovery yet. I think the nurse thought they had told me about the ovarian cancer, but she kind of blurted it out, and I'm kind of like, wait a minute, what? So it was definitely a shock, and I think at that point, you know, it was beyond overwhelming to hear, but I was glad that I made that decision to have both my ovaries taken out. And as I mentioned, my doctor gave me the choice of keeping one, so I'm really glad that I, you know, went with my gut instinct. So I can't believe I actually had ovarian cancer the entire time. So thankfully my doctor and his team recommended that I didn't actually need to have radiation or chemotherapy due to both cancers being completely separate and contained in their respective organs. So I was a very lucky and unlucky situation, as most women with ovarian cancer, as we've heard today, do not know about it until it's already progressed into their body, making survival difficult. And as I'm assuming everyone here, at least on the panel, knows, and hopefully out here knows, that ovarian cancer doesn't have an accurate or early detection method, unlike many other cancers and diseases. So you really have to rely on your instincts for this silent killer. I am now almost 5 years cancer-free and cannot express how proud I am to have come so far. I feel as though my mother saved my life because without the knowledge of the genetic disease, my outcome could have been different. Although I did not have treatments, I've experienced many side effects that have challenged me every day, including chronic stomach pain, instant menopause without an option for hormone replacement, weight gain from medication and inactivity, financial burdens, which I don't think most people talk about,
Oh, God, yes, that's true.
and the inability to have children, which I've mentioned. I now require yearly endoscopy, colonoscopy, and urine cytology testing, along with twice-a-year visits to the Abraham Cancer Center, as well as a genetic dermatologist who specializes in genetic skin disorders. I'm screened for skin mutations that can also occur with Muir-Torre syndrome. So nothing seems to be left out with this genetic disease. It kind of covers everything. I actually kind of, I was telling him recently, I feel like I'm Norm going into UPenn. I have so many doctors. It's kind of like, you know, hi, like I literally cover almost every department. It gets to be, yeah, I'm trying to make light of it, I guess, but, so, you know, like I mentioned, I'm screened. You know, I have had, since my surgery, many procedures, treatments, biopsies, all adding to my already difficult situation. I've had a few scares, but thankfully none of them have caused any greater issues so far. I know I'll never be the person I was, but I'm fighting really hard to be the person I want to be in the future. One thing that's very challenging is I try not to let the negativity consume me. And throughout the pain, the procedures, etc., I still live my life as much as I can. And I think that's important to note, to kind of project that same positivity onto your patients, because I think mind over matter is really something to be said. I mean, I don't know how you were, but it sounds like you were really strong, you know, through your story and yours as well. So I think that really plays a big part of it, is not feeling like there's no hope and not feeling like it's doom and gloom and you have 2 months to live. It's, no, you have, you know, you have the strength to get through this and to be that 1% that makes it through. So I think that's very important. Just one quick thing to note, the awareness for the Muir-Torre disease and ovarian cancer have become very important to me. I've been involved in walks, seminars, sharing my story with others in hopes of making a difference. I want to support not only ovarian, endometrial, and Muir-Torre education, but for all cancers and diseases. I feel that genetic research is an important tool for early detection and hopefully ultimately cure someday. I know my illness will always be a part of me, but I'm trying really hard to not let it define who I am. And one thing, I don't know if I have a little bit more time. Okay. One thing I kind of added in here was something maybe I wanted to share with everyone here, my perspective, looking out onto future doctors. I think that being a doctor is more than just knowing how to diagnose, treat, etc. And I feel bedside manner is very important. Often doctors, especially a gynecologist or oncologist, will be present during many difficult and scary times in their patients' lives. And it's very important to make you feel like you matter, like you're not a number, and that on some level they can empathize with you, and you don't understand how much that makes a difference in all the world. I mean, I can't help but wonder if her experience would have been different had she have had any of those things with the doctors, yeah, with yours. So in addition, I think in most cases, after the surgery is over and the treatments are finished, the patient still has long-term effects, as I can attest to. So providing the same level of care at that point is still crucial and necessary. I've had both spectrums of that care and cannot explain how great it felt when my new oncologist, who I actually just saw for the second time today, came in his first appointment, and he had already researched my history, which made me feel not like a number, like he actually cared. And he recommended testing my cancer cells, which has now been almost 5 years, for this CEA marker, he called it. And this can be used as a, it can't be, I guess, a formal way, but it can be used as a tool to prevent further cancers. Because the CA125 is proven to be not very accurate, because he actually found the CEA in my cancer and the tumor, now he's testing my blood every 6 months for that. And that's kind of a marker where if that number goes off the charts, then they'll know that maybe something is going on. So it really was important to me to know that even 5 years out, he's still looking for ways to help my health going forward, especially since I have a whole slew, unfortunately, of cancers that could, you know, pop up at any time. So I would ask, all future medical professionals to trust your instincts and that know because of you there is technology, tests, physicians, nurses, and surgeons to give people the best reward any job could provide, which is life. The most important lesson I took away from this whole experience is the instincts and preventative care are the keys to survival. Without them, my mother might not have noticed the report that led to her knowledge of Muratori. Without that knowledge, I might have thought the uterine cancer was the only genetic link and not opted for that full hysterectomy, which led to the discovery of the ovarian cancer. In addition, my mother and I have been educating our family to get tested to see if they too could be at risk, because she had two brothers, or has two brothers. With them, my uncle ended up testing positive, and he had a colonoscopy 2 years ago where they actually found a benign polyp at age 49. So he would have not even gone in for another year, and had he not known about our genetic mutation, that could have manifested into something else. So I think that I'm trying not to think negatively and just be thankful that I can be a testament to others. If I help just one person think twice about their own family genetic makeup or current health status, and I know that despite everything, I can make a difference. The best advice I could offer someone facing an illness is to stay positive, no matter how much it tears you down, fight for the life you deserve, and be proactive, because no one at any age, class, race is invisible to cancer, disease, or illness. Who knew how much a pair of jeans would change my life?
Can you guys talk about what the process was like educating yourself on what the treatments were like? From what I got from most of you, that you had to do a lot on your own. There wasn't a lot of good education from the physician and the healthcare team.
I know as far as...
Hi everyone, my name is Deborah Batista, and I am the New Jersey coordinator for the National Ovarian Cancer Coalition. I am not a survivor, but these three women to my left are true heroes. And I say that because they beat the odds. Over 70% of women who are diagnosed with ovarian cancer die from it. There'll be about 22,000 women diagnosed in 2015 and over 14,000 will be too late. And that has a lot to do with the fact that the symptoms do mimic many other things and people ignore them. So I think it's very important to realize that to be a pain in the ass to your doctor is not such a bad thing, and that you as doctors and professionals should really champion those people who are coming saying something just doesn't feel right. Pay attention to that. I was a caregiver. I lost my sister to ovarian cancer, and she was 46 years old. She was had her surgery in August, and she died December 18th, so she had 4 months. So we didn't have the time to really digest everything. It's one of the reasons I took this job. So just wanted to say that. Thank you, ladies.
For the first speaker, I'm sorry.
Gail.
I know that you said that your doctor knew for 8 years and didn't tell you. I'm just wondering, how that could have happened and what was his reasoning for not saying?
Okay, so, well, I wonder the same thing. He didn't know I had cancer for 8 years. He knew that when I first took the genetic test, it was LabCorp that did it, and they give guidelines that are not just recommended, it's what you're supposed to do as a doctor with your patient. And I'm pretty good at following directions. I'm a doctor's dream in terms of compliance, but honestly, you don't know exactly what you're in for, what you're looking for. So now that I read back on it, it said I was supposed to have the CA-125 twice a year, the transvaginal ultrasound every year, but there was one part that I left out. So 7 years into it, I'm like clockwork. My gynecological appointment was every August, no matter what. It was on my calendar. And I was due for my appointment. I got a call back from the gynecologist's office that he was having total knee replacement. Would I like to wait for him to come back, which could be, who knows, or have one of his colleagues see me? I don't know what possessed me to say, I'll have one of his colleagues see me, because, I have to stay on my rigid schedule. So I went in there, and this is the first time, and this was August 2011. So this new doctor looked at my, first of all, he wasn't even giving me a CA-125, which I was having for years. He was giving me pushback, and I pushed right back on him and said, I need you to read my notes. Because many times doctors just, you're not a patient, you're new, I'm handling you for one of my colleagues, and whatever. And the first thing he looks and he says, did anybody ever tell you to have your ovaries removed? And I was like shaking, are you kidding me? It's like, I never heard this. That was like, what kind of ridiculousness are you talking about? But when I went back after all of this and read it, it said, if your patient is of a certain age, and I'm 61 now, so I found this out when I was 57. So I was well past my childbearing years, and there was no reason why I shouldn't have been told about having my ovaries removed, given the family background, but it was never brought up. This guy is the guy that actually read the material after he got the CA-125 results back and actually told me about this. But this other guy just wasn't keeping his eye on the ball for whatever reason, I don't know. And, it was way too late. And the same doctor, I had one of my best friends found out she had stage 1, which, she was lucky she didn't need the chemo and gone through that whole rigmarole. But I guess the moral of the story is read the information you're given. God, I look back on my thing, and I was tracking this stupid thing for 8 years. I was tracking this with my whole family. I originally found out about this, and this is kind of a terrible, unfortunate thing, but the way this whole thing just kind of took a turn was my aunt had passed away, and we were at the funeral at my family plot, and I was saying in the beginning, I have a very big family. There were 6 siblings, and everybody fought. Nobody spoke with one another. And my cousin, who was 63, died. And we discovered it because we found her plot there. And that was kind of scary. And after going back and finding out that she had fallopian tube cancer and then ovarian, that's when I started this whole bit. So for me, of all people who were tracking this for 8 years, to discover at the end of all this, because my doctor wasn't paying attention, that I had stage 3C. And now my chances of survival are like best 40%. Having 3 cancers in 3 years, that's a lot for somebody who's tracking it. So, your question is very reasonable. That was the exact same thing I'm thinking. Where was this guy? So, it's on the doctor, it's on the patient, but, as future practitioners, we're kind of in your hands in some respect. So thanks for asking that question. You're welcome.
Other questions?
I was concerned I use a good old-fashioned internet. I know they always say don't WebMD everything, but that's kind of precisely what I did. And I just went on multiple websites, so that way I would, be able to, weed through maybe what wasn't true and just try to do it that way, I think. And obviously listening to what the doctors say, but, they only have so much time with you, so. I don't know if that's the best way, but I think that's probably how most of us know so much, is by using the internet resources.
I think right now it's such a good thing that internet's out there and Google and all that. This was almost 13 years ago. There was no Google when I was diagnosed. There was no talk about ovarian cancer when I was diagnosed. I had a friend of mine that said for me to go to Gilda's Club. Everybody knows Gilda Radner from Gilda's Club, Saturday Night Live. She had ovarian cancer. Oh, she made it. Yeah, true that. But she was awesome, and they gave ovarian cancer the name of the Gilda's disease. And that's when I was like, wow, really? Nowadays, it's awesome. I speak to women all over I have women that I talk to in the UK, in Texas, Kansas, everywhere. They'll call me and, you know, they want to know, they want support. We call each other Teal Sisters. You know, there's a bond when you have ovarian cancer, because like you said, we're very, very lucky to be here. It's a crucial and dreary thing when you have this disease. Financially, it sucks. We had to declare bankruptcy at that time because I was so in debt with medical bills. You have to deal with insurance companies calling. You know, it's a lot of built up, a lot of stress. Sorry I went off the subject, but you know, I'm just trying to put a little bit in perspective out there.
You brought up a good, you mentioned reaching out to people. I actually found on the internet the NOCC website, which is how I became involved with the organization. When I had reached out to the Philadelphia chapter, they actually set me up with someone who called me, as you mentioned, spoke with me. They sent me a little kit about, you know, ovarian cancer and different information and different resources or tools I could go to if I needed a support group and so forth. So I think that even just there's this Hyster Sisters website that is for women who've had hysterectomies, and you can go on there and, you know, encourage people, whatever. I mean, it's like a blog, but I mean, it's people who are going through it initially, sometimes you really need that because your family members don't quite understand exactly what you're going through, and it's nice to hear from someone, you know, probably who has, for sure.
Oh yeah, I mean, I think, like I said, the cancer community is a very strong community, and sometimes I feel that when I'm with someone who's been through cancer, we get it, we understand. Versus when I speak to someone who has never experienced it, they're like, well, what do you mean? Well, what do you mean? Well, it's just that kinship that we have. It's a great feeling. It really is.
I'm just going to also add that I don't think the New Jersey chapter of the National Ovarian Cancer Coalition, their website existed a while ago either, but it does now, and they have local chapters. And the people that we're meeting with later today actually are primarily survivors and caregivers. So that's who comes together. They're the people who volunteer to spread the word and spread awareness. So ovarian.org is the NOCC website, and that's available as well.
And just one other thing, when I was going through this, and I was going through a clinical trial, and my sister, by the way, is an endocrinologist, so she was helping guide me through this, because when a patient goes to a doctor and you're in a state of shock, a doctor's talking with you, and sometimes you're not absorbing everything. And you need somebody else with you to write things down. You're looking at them, and some stuff's sticking and some stuff's not. But I was lucky enough to have a gynecological research nurse that was part of this whole clinical trial relationship for Morristown Medical Center, where I've been treated. And I'm a frequent flyer there as well. I'm like in there every week for something, blood work or whatever. But she was very helpful in explaining everything that was going to be happening. I was also told in the beginning, you'll scare the daylights out of yourself if you go online and start reading statistics. It really is, as they were saying, it's such a state of mind. But there's also, aside from ovarian.org, the hospital put me in touch with, there was two things that were really helpful. The American Cancer Society gave me a call, which I think they do to mostly all of us. They send us information. It's everything you want to know about anything having to do with ovarian. They'll send you cookbooks. They'll send you, they'll call you frequently to see how you're doing. But there's another really, really good outlet, and I'm still in touch. One of these women is part of the NOCC, but she moved to Boston, Laura. And it's called, I think it's the Cancer Network something or other. I think they're located in Chester. And what they do is, and there's other organizations that do this, you give them a call, and they match you up with somebody who's going through the exact same stage cancer you're going through. They give them your phone number, and they act like a buddy for you. They explain what has gone on with them. They're there to help, to inspire, to guide. Even if they're one step ahead of you, they're one step ahead of you. And so those resources are really good. And I'm on 4 different Facebook pages for women going through this. And you'd be really surprised women are going through this and they're still asking questions that they really should already know that they don't really know, and they're looking for us to provide some guidance because I think their doctors are just not helping them that much. So, you know, as I think we're all telling you, the amount that you can put into this in putting your hand out there and helping any one of us going through this, it just makes such a difference. You can't believe it.
For the last 2 panelists, you were both very young, and both of your doctors gave you the suggestion of leaving your one ovary in place to preserve fertility in the future. I was just wondering if anyone ever offered egg freezing or that possibility to have children in the future. If that was ever offered to you, or if that was possible to you?
I went to see the Penn fertility doctor leading up to the months before my surgery. I actually was going to try to do the process of freezing, and it just, once they did their final biopsy, they just realized it was going to be too, I mean, that takes several months process, and they just kind of felt that, I guess my health would come first, that, you know, it could have progressed in the time frame that I was trying to freeze eggs. But it definitely was something that I was trying to do, and, you know, that's been, I mean, everything obviously I went through was horrible, but that has been still an ongoing, you know, forefront in my mind that I wish I would have been able to. And I actually asked, and I guess maybe technology hasn't caught up yet, but I said, I'm like, well, can I just freeze my entire ovary? But they don't, I guess there's no way to actually produce an egg yet, like, you know, so hopefully in the future they'll have that technology. I was just not able to get to that point.
Yeah, I was pretty much told the same thing. It had spread, and it was spreading too fast. That at the second surgery, I was told that at this point it was just way too late to do it.
And you weren't producing them at the time.
And I wasn't producing them at the time.
Yes.
And that's why you have a caregiver. Like Gail said, he came with me, and you always bring somebody with you because when you go through everything, you kind of forget what's going on. You really do forget. Even now, he'll say to me, hey, T, don't you remember this and that? And I'm like, nope, don't remember. So it's very important that you have that special person, husband, wife, whatever, next to you, to take with you.
Being that you guys haven't had like really great experiences with your healthcare providers, how do you, I guess, how would they regain your trust, or how does that work when you come back from your chemo and now you're feeling better and you have to continue to care with them? Like, how does that work as a relationship? Like, how do you regain trust, I guess, with your healthcare provider?
Well, I've had, my present healthcare team is terrific. I have an oncologist who's a second opinion person in Sloan Kettering in the city, who isn't as caring, but I'm not going to marry him. I just need to you know, it's fine. And I have 2 oncologists at Morristown. I have the surgical oncologist, who is just on a scale of 1 to 10, she's like a million. She's terrific. And my medical oncologist, the same. They talk about everything. It's a team. And the radiation oncologist, same thing. I have their email addresses. They get back to me like, and I don't bother them. So if, like, this pill came out, I sent it out. Believe it or not, a week later, I have the medication. It's amazing. Not everybody has such a wonderful team, and that's the stark opposite about what I was telling you about the gynecologist, who I don't think he probably cared, but he wasn't on the ball.
Well, I think, from hearing your stories, I think I had a little bit better of an experience. And obviously I was more fortunate as well to not have to go through chemotherapy and those treatments. I mean, I've had a lot of side effects, but I think right away, and from what I'm hearing, when I was at Jefferson, nothing against Jefferson, but they didn't have as large of a team. I think they waited too long, when I had that polyp and they discovered it. I mean, and I think he kind of was aware of that, which is why he pushed his superior to get me the second biopsy, which is where they found it was, worse than they originally thought. So I think it's just really, if maybe it's just the patient to doctor relationship is just different for other people, but I kind of just could get a sense, my instinct, okay, this isn't working here, I'm gonna go, somewhere else. And even my oncologist at UPenn, who now has since left, he was, as she said, I definitely wouldn't want to marry him. He had no bedside manner, but he was amazing at what he did. He was the head of the department, he knew what was going on. But every appointment after that, I kind of felt like, he's looking off, and my surgery's done, I'm not going through chemo, I'm just, not as important. And where I've had these ongoing issues, and it's just nice now that I have the new oncologist who's really, like I said, found that new marker for me. And even just today, I'm telling him things that are coming up, and he's going to have some other tests run. And, it's just nice to, I think, be able to find the group you like. And I think the problem is when you're initially going through it, you may not have that luxury of finding the group that you like, or that works for you, or that's going to give you the care you need. So it just would be nice, I guess, if they all were like that.
I'm going to make a suggestion to answer that question because of what happened to my sister, because these three are heroes. They're here. When someone is not going to make it, it would be really great if that provider could kind of put the spotlight on themselves and say, what would you want to hear and what would you do if this was happening to you? And that was never done. There was never a doctor, even when my sister was in hospice, who said, if I were you, I would do this. I mean, they allowed her to just live on hope. So just something to think about. Turn the spotlight around and say, if you were in this situation, what would you do? There is if you do a Google search, there's a letter that a doctor wrote to a cancer patient. It actually comes up if you just put in letter doctor wrote to a cancer patient. And in this particular letter, the doctor knew the person who was diagnosed with cancer. I don't know exactly what the cancer was, I don't remember. But the way he wrote the letter was so personal and so appreciative. It should be a best practice.
I have to go to doctors no matter what, as we all do. I still trust. It's just the type of person that I am. But I'm definitely more outspoken than I was. And it's asking questions. And funny enough, when you go through, like you said, your first impact is you don't know the questions to ask. That's the problem. You go in, you don't know the questions to ask. So thank God nowadays that there is the internet and the whole thing that you can ask, and there's websites and Facebook and all that stuff that you can go out there and you ask someone who's been through it. That is the thing. It's the goal is to get out as much people out there to bring this awareness to everybody. And one point that I do want to make, that it's just not a woman's disease. I have a lot of men who say, I'll approach them and I'll say, you know about this, whatever. Oh, this is not for me, And I'm like, well, wait a minute. You have a mother, I'm sure, You probably have sisters, cousins, female friends. Why wouldn't this be about you? And it's sad that men still think that way. So I want to bring it out also to the men, that just keeping a little ear out of your moms, your aunts, of what's going on, and say, hey mom, maybe you should go what questions to ask.
to support and get behind breast cancer, which, you know, obviously nothing against that. And a lot of women who have ovarian cancer have the BRCA gene, and they have ovarian and possibly breast cancer, or the risk of either. However, as everyone knows, I don't know what the stat is, something like 1 in 7, 1 in 9 women will get breast cancer in their life, so it's very devastating. But they've come so far, and there's so many women who can, you know, get early detection, and there's, you know, obviously mammograms and ultrasounds that can detect it early. I think that a lot of, at least the United States focus seems to be everything about that, and, you know, the football players, the NFL, to, you know, even my nephew's team, they have, you know, the pink socks, and it's really cute and it's great, and I love that it brought so much awareness to that disease. However, ovarian cancer, I don't know, quite gets the same attention. However, it's the deadliest of all the gynecological cancers, according to the American Cancer Society. So I think maybe just since I've been a part of it, it's becoming, I think, more and more known. But I'm hoping the word can kind of get out there a lot more.
Yeah, it's such a taboo to talk about anything from the waist down. Even like, it's not true. This week, right? That's good. That's a good thing, because growing up, I'm European, so growing up, my parents, my mother, never gave me that talk. You know, it was never, we never talked about it. You know, it's like, oh, you go to the doctor, let the doctor deal with it. Or, you know, oh, go to your sister, and your sister, you know, my older sisters will be like, you don't need to know about this stuff. So you get, you know, you grow up, you become a woman, you're like, oh, okay, whatever, you know. And you go through all of this stuff, and you don't know what's going on. And it's all so important to talk to your daughters when you have kids and all that. Know your family genes. Know everything that's going on. You know, years later, I found out that my aunt had ovarian cancer. At 29, she had ovarian cancer. Now, why wasn't this told to me as I became a woman? So the taboo of talking about, oh, you know, you don't talk about that stuff, has to go away. They have to be open and honest and, you know, all that stuff.
Tina, my question for you was, during the 2 years of your symptoms, you have primary care doctor you would see, or were you just going kind of from specialist to specialist, and obviously nothing was working? We're all sitting here kind of scratching our heads, like, if you rule out GI, if you rule out the other symptoms, how come nobody was thinking, hey, maybe cancer for 2 years, and you have symptoms?
That's correct. It's mind-blowing. It really is.
Well, the reason was because no one knew your history, and
Right.
you didn't have that history from your family.
Right.
On top of that, it was just being pushed off at something else. As far as IBS, as far as this is, you know, other symptoms were telling you it was this or that, and instead of concentrating on all the symptoms, it was just one symptom here, one symptom there at a time. And unfortunately, not one doctor got it and said, okay, let's put it all together. What's going on here?
Right. Even doctors.
Did you guys all hear that? Yeah. Okay.
Even nowadays, because, and I was saying this earlier, ovarian cancer has a stigma also of being a old person disease. Mm. So a lot of times where young women will go to the doctor, I mean, we're young, you know. We went to the doctor, even younger, and they're like, oh no, we can't do this CA 125, or we can't check for that because you're only 19. So it gets dismissed. You can't have that. You're too young. You don't have the history. You're too young. So it's constantly getting pushed to the side versus actually listening and getting the grasp of the whole thing. We have, we know a group called Graceful Hope, and their aunt. Their aunt was diagnosed with ovarian cancer. She went through the whole procedure, and as she's going through it, her daughter, who was 16, starting to feel the symptoms. Went to the doctor. The doctor said, no, I'm not doing any testing. You don't have ovarian cancer. Sent her away. She constantly persisted. The mother was constantly getting treatment and all of that. The daughter went back again. She got diagnosed with ovarian cancer. The mother died of ovarian cancer, and her daughter died as well of ovarian cancer. If the doctor had listened to her and did some kind of testing, CA-125, the vaginal ultrasound, something, she might still be here. Because the goal is to get it at an early stage. But because the doctor dismissed it, it took another life that it did not need to take. And that's why we all do what we do, is to get the word out there and the awareness out there for all of you to understand.
I wanted to see one thing. We were mentioning like it was 2 years that went by. In my story, I didn't really mention this, and I'm still not sure whether it was linked, but 2 years prior to the heavy bleeding and finding out about the endometrial cancer, I was having a lot of bloating, stomach pain. I went to, I think it was still Jefferson I was at. They did a bunch of testings, and they said the same thing, IBS, dyspepsia, if I'm pronouncing that right, everything. They just did all these different stomach tests and from the GI perspective, and they never really found anything out. And actually, I ended up doing a gluten-free diet. This was back in 2009, way before it was a fad. So I'm like, I started this movement. I was just reading online and read something. I was at my wit's end because I would just feel so bloated and so sick all the time after having like no food. And it was you know, very disheartening. So I eventually just did that on my own, and it really helped my symptoms. I still kind of do it now for the most part. So I don't know whether maybe that was my body telling me then. It was, you know, I don't know if there's a correlation. It's just, it seems a little too coincidental that that is a lot of the symptoms that women with ovarian cancer have. So I mean, who knows? Maybe I had it for a couple years as well, and it was diagnosed the IBS or dyspepsia. Yeah.
The one thing I want to add to this, though, that I think is really important, if you don't know already, there is no uninvasive test to check for ovarian cancer. It doesn't exist. I think Krista mentioned before that, you know, like it's like 85% of people who get breast cancer, you know, can survive, but that we have about less than 20% that survive ovarian cancer. It's because there is no test. There's no pap test that does not check for it. The CA-125 might tell you if you have cancer, but not necessarily what cancer you have. So it's important to know that's one of the reasons why we try to raise awareness, because there is no test. And we want to raise funds to eventually get it there. We want teal as big as pink in people's minds, and it just doesn't exist right now. So that's one of the things we're working towards. If anyone wants to do the walk, it's September 27th.
Just one more thing I just wanted to point out. Your doctors, you're going to be dealing with insurance companies. They're financial people. Fight back, take a step, take an extra step, because many times these doctors will say that they're encumbered and their hands are tied because they can't get certain tests through the insurance companies. That might be true. Take the next step and be an advocate for your patient, because insurance companies don't rule. You guys do. And I would rather you take the risk, and I'm not your teacher, but better to take the risk of pushing back on the insurance companies than having one of your patients end up like us. So.
Those were both really great points. So I just want to reiterate Deborah's point. So CA-125 is not a screening test. It's a test that can tell you just if somebody has epithelial ovarian cancer. We just talked about it right before you guys came in. We had the science of it. So it doesn't tell you about any of the other cancers. And it'll be falsely elevated in somebody who has endometriosis, and somebody who is pregnant, and somebody who has IBS. So, which is why we don't order it as a, you know, come for your annual visit and we'll give you a CA-125. So that's a really great point that you brought up. Thank you. And then Gail's point about the insurance companies, all the time you will order a test and they will say, not indicated, we can't do it. And then you'll have to send a letter saying, here's the reason why I do want to do it. And probably 70% of the time, then they'll say, okay, and sometimes they still won't, and then you'll have to say something else. There's always, just like when you're taking a test, and I'm always telling my PCM kids, there's a buzzword that shows up on the question, and that's the buzzword that's going to lead you to the answer. Insurance companies are the same exact way. There is a buzzword, and if you say the buzzword, you will get what your patient needs. So be aware of that. That test-taking skill should serve you well for your patients. I saw a hand back there.
Krista, yes.
Tina.
Oh, here, Tina.
I remember you said that you had missed your third round of chemo. At any chance, did the doctor ever tell you that there could be a possibility that your cancer would go away if you didn't eat it?
They told me that I would probably pass away if I didn't continue my chemo. Like, they did not have any other protocol. Like, back then, that was the only 2 chemos available, treatment. That was it. So there was no other way, there was no other medicine to give me. And I felt that the chemo was worse for me than anything else. So that's why I stopped. She was against it, totally against it. But I felt, and I came to peace with myself, that I felt that if this is the way that I'm going to pass, then I want to do it on my terms, and I want to spend the time that I do have with my family and remembering it and being somewhat healthy, you know. And 12 years later, I'm still here, and they still have to put up with me. So.
Hi. So, given what we just said, that any testing for ovarian cancer is going to be invasive, I was just thinking about that story with the 16-year-old girl and what your thoughts are, because we talk a lot about the harms that can come from testing. And there are a lot of situations where you don't want to just keep looking and looking and looking for something that may not be there. So I was just wondering if you have any thoughts on how to balance those two sort of competing goals in treating a patient, because especially with a 16-year-old, you can understand she's just really scared watching her mom go through something like that. So, if that's the case, you wouldn't want to do all this invasive testing. So, as a physician, how do you balance that? How do you explain those risks on both sides to your patients?
So you do have to be conscious that you're doing that risk-benefit analysis constantly. But in that 16-year-old case, her mom had ovarian cancer. Like, genetic testing is indicated in that situation. A transvaginal ultrasound is not. A CA-125 is not. But you know what? I would put large money on if genetic testing was done that they would have found something. So, you know, like, I mean, part of the reason in Tina's case that it took so long, you talked about the 2 years, was because we put these biases on, like, oh, age, like, you know what, she's not of the right age, then I'm going to rule this out. And it shouldn't always be ruled out. It should be lower on your differential, but as you work through it, it should come up. And people will give you other information. And if you start ignoring that other information, that's when we start missing diagnoses. But in that 16-year-old's case, besides her symptoms, she actually gave other information. And so there's your balance. So, you know, I always say to my residents when they have patients coming into the hospital, and like one of the first things they'll present a patient to me and they'll be like, oh yeah, this is a patient, she's a frequent flyer, she's been here like 4 times. I'm like, you know what? Nobody wants to be in the hospital. As much as we're really great people, nobody really wants to see us. You know what? So if they're coming to us, it's because there is something not quite right, and it's our job to figure out what that is. So don't ignore it. Right? Other questions?
How does the support that you receive from men differ from that of women? And also, were all the healthcare providers from which you had bad experiences with men, or were there women?
No! You know, it's funny, in my case, I hadn't thought about this, and honestly, I never had women doctors before I had an oncologist, but the gynecologist I worked with, he was a guy, And I don't think that it's a gender issue, but I found that, and the guy at Sloan, who I said, you know, great facts, but I wouldn't want to marry, he was a guy too. But these three women oncologists were, and like I said, I can't say if this is a gender thing or not. It's just coincidental that it's like this. But
it's not gender.
It's
there's
not.
mean men and there's mean women, and there's nice men and there's nice women.
Yeah.
I can't say in my case that it was, even though it's, now that I think of it, it's kind of coincidental.
No, I had both men and women. They were both pretty much the same thing. But I wanted to mention about what you had said about your residents coming to you. And when you started the conversation, you said this patient is a frequent flyer. You are assuming something. And that right there is a no-no. Because I was called a hypochondriac for the 2 years. So you just labeled me, where I'm telling you everything. And you should never label your patient. I mean, we're all human. We all have our days. Oh my God, you know, I know you work 24 hours a day. You're in there. You're tired. But when you're labeling a patient, that's so bad.
Oh, last question.
Yeah, just some of you alluded to working at the same time while you were going through this. Can you talk a little bit about how, like, if you had any issues about, like, discussing to your employer why you're missing so many days, that sort of thing?
Yeah, well, I had to go through FMLA, and I had to take the chemo was extremely debilitating, and I'm in sales, so you know I had this wig on, and I was like a stick, and they knew, and I guess it's scary enough when you're a cancer patient. Thinking you're going to lose your job is scary too, especially when the insurance is under you. Because my husband was working as a consultant at the time, and certain people can be very kind about it, and certain people can be very judgmental about it. And there's a whole lot, I know at Morristown they have pro bono lawyers that talk to you about how to deal with all of this stuff. I have to be very honest with you, when I got my recurrence, I just started a new job a year ago November, and my recurrence happened in the March-April time frame, so I was only working for the company like 4 or 5 months. And I was very, very, very lucky. I was on a different treatment. I didn't lose my hair, and I didn't lose any weight. I told my boss, he said he wouldn't tell anybody anything. He never did. And my reaction to the chemo was actually working with me, thank God. And my boss left the company, and they still don't know that for 6 months out of the 1 year I was working there, within that first year, I was going through chemo and a recurrence. I was scared to tell them because I was new, and I figured they would think I'm broken. And, you know, think about it for a minute. You just hired this new person who's going to be out there with potential customers, and there's something wrong with her. And, you know, is she going to die on me, or, you know, what's going to happen? And, you know, all these things go through your mind. It's something that a lot of cancer patients go through. It's a big deal about telling your employer about it. But when you're going through things like you have to be out for chemo, well, my present employer, when I went for chemo, I kind of tried to tuck myself in a corner if there was one at the time I went, and I was taking conference calls in between, and I put somebody on hold when I heard my bag beeping, you know, so people didn't hear the stuff that was going on in the background. That's kind of tough. But, you know, I think this all comes down to how you want to push through this and what your frame of mind is. And I know some people who just can't work at all. And I really shouldn't have been, because I had chemo brain like whatever you just asked me 2 minutes ago, I wouldn't have even remembered. But I did anyway. But, you know, it really depends on people's reactions and how much they need to be, you know, how much they need job security.
I think I had a similar experience. I was not in sales, I'm in finance, so my employer was really great at the time. You know, I luckily didn't have to go to the chemo, so my treatment wasn't quite as long. I was out 8 weeks on short-term disability. They were great through that, and then because of all my scar tissue pain and everything, I was kind of part-time, I think, for 2 months, and they really worked with me with that. So, and then even when I came back, they said as long as you get your work done, if you have to leave for appointments, etc., they were really helpful. But what you said was very interesting. I've been in my new job now for 2 years, and I was afraid to tell them. Like, I know there's, you know, HIPAA laws that protect, you know, employer can't not hire you. But especially being, you know, younger, I'm trying, you know, to, you know, get myself up the corporate ladder. Like, I'm afraid that they're going to judge me if, you know, the CFO, you know, is going to know this about me. If she's going to think of me differently, or think, oh, well, what if something happens to her and we, you know, give her this important role or something. And, you know, even I have a new boss now, and I'm afraid to tell him because I don't know how he would react, or if he would keep it secret, and if he's even legally has to keep it secret. And it's just, it's tough because you just don't know. I mean, people try not to judge you, but unfortunately we live in a society where everybody judges, even if you're not trying to. So I think probably most employers are, as long as you're not physically having to do work, are probably helpful, but at the same time, you know, I get very paranoid about it.
Yeah, you all are tough cookies, though. That's super, super impressive. I have to tell you, when you guys are filling out disability paperwork, to keep in mind that every patient is different. So you're going to have, you know, 2 patients with the same exact problem, and someone's going to say, I want to work, like I need to work, this is what's keeping me going. And then there's going to be other people who are just going to be completely debilitated by it, saying, I can't function, like I can't be in the work world. And it's either way is okay, and you guys have to figure out what's right for that particular patient. Correct.
I wasn't able to work. I stayed home because of everything that happened to me through the chemo and the surgeries. My boss was good throughout that time. Then when I returned back to work, I had a little scare, so I kept on missing for doctor's appointments and everything. Then I got terminated. So, yeah, they told me I was missing too many days, so I got terminated.
Or I had the opposite experience, so it's a shame.
Yeah, a lot of employers don't understand. Unfortunately, that's just the way it is. My last job, I was there for 3 months, and then when I decided to actually tell somebody, I think I lasted 2 weeks, and then I got let go. Yeah, so it is a challenge even now when you start, because you know, you tell a coworker, you know, you become friends with a coworker, and you know, I wear teal all the time, so everyone's like, ooh, why you wear teal all the time? Why you wear green all the time? So you tell them, you know, this is why I wear it. So one person tells HR, so then I was terminated. Really wrong.
All right, well, hopefully you will encounter other people who will not be, so.
Oh, I'm good.
Well, thank you again for coming.